In a move to address the growing burden of cardiovascular diseases, the Aga Khan University Hospital has launched a cholesterol disorders clinic dedicated to manage cholesterol disorders. The initiative seeks to offer specialized care, advanced diagnostics, and personalized treatment plans to patients at risk of or living with cholesterol-related disorders. Dr. Mzengunga, the lead interventional cardiologist for this clinic, said cholesterol management will reduce incidences of heart attacks caused by blocked arteries, which has become common among Kenyans.
We are able to offer some of these services routinely in our lab. For example, when we started, we were not able to offer lipoprotein little a, ApoB. But now, after sending, because we are going to do 200 of this, and most of them are actually very high in the patients who we are seeing in the clinic, we are increasing the capacity to do this test in our patients. We are offering the capacity of what doctors can do. We are able to do genetic testing, and I remember even minor, because the challenge was these tests are very expensive. You can't just be charging people this kind of money. And he was able to say, oh yes, if we diagnose the patient, then the probabs can actually be treated, have a cheaper test, because we know which genetic abnormality to look out for. So we have actually improved capacity in our lab by enabling us to know once you find this genetic abnormality, then it is actually easier to even examine the probab, because you know now it's actually a more limited test.
The clinic will also offer patients a longer life expectancy without requiring more complex medications that are normally prescribed for patients who have survived heart attacks.
Research has shown that when such diseases are caught early, the outcomes are better, and obviously the costs are lower as well. Rather than wheeling the patients into cath lab or OR, you treat them in the clinics. So obviously the costs are lower as well. But it is extremely important for us, because we are not only concerned about treating the patients, but also training the doctors and the nurses for tomorrow.
The lipid disorders clinic is run by a multidisciplinary team of cardiologists, family physicians, nutritionists, specialists, nurses, and pathologists, ensuring optimal care to the patients.
This clinic is going to give us a lot of data in terms of the patterns of lipid disorders that we have in the country. And when it comes to management of lipid disorders, we've tended to perform very poorly, not just as a country, but globally. For example, we were just looking at the data from the INTERSPIRE trial, and we noticed only 16% of patients across the globe actually reach target of LDL for patients who are on secondary prevention for cardiovascular diseases. And there are many factors to this. Physicians don't want to prescribe the right medicines. For whatever reason, patients drop taking medicines along the way. Healthcare institutions do not have the right medicines to give to patients. So we need to tackle all these challenges as we try to improve the outcomes and reduce deaths among our patients at primary prevention, and even for those who already have had diseases, and we need to prevent them from dying.
The move by Aga Khan University Hospital will ensure patients have access to an assessment of cholesterol to determine the specific lipid abnormality, genetic tests to determine the underlying genetic defect, analysis of the results by an experienced team of cardiologists and family physicians for patient-centered management, appropriate dietary advice, and education on how to maintain cholesterol at acceptable levels.